Welcome to VACORP's Back Safety, Back Injury Prevention webinar. This session on back safety discusses one of the most common workplace injuries and what you can do to help prevent back injuries. You'll learn about the many ways you might injure your back as well as what you can do to prevent injury. Does this look familiar to you? In this session, you'll be able to, 1, understand how back injuries occur, 2, prevent back injuries, 3, use of proper lifting, load carrying, and unloading techniques, and lastly, think intelligently about your back. Why do you need to know? 80% of Americans will have a back injury that requires some type of medical attention. Back injuries are the second most common cause of days away from work, next to the common cold. Injured backs are often subject to re-injure. And in addition to missed work, there may be a lifetime of pain. So why do back injuries occur? The back has many integrative parts or interactive parts. There are 33 vertebrae in the backbone that extend from the hip bone to the base of the skull. These vertebrae protect your spinal cord. Between the vertebrae and gel-filled pads called discs, which separate and cushion the vertebrae and allow your backbone to be flexible. Your back also contains many muscles, ligaments, and tendons that connect to the spinal cord with nerves. This system allows you to bend and turn your back and keeps everything properly aligned. Injuries can happen to these various parts if they are torn, stretched, bruised, strained, or cut. Here we're looking at the basic structure of the human spine, which is made up of discs, vertebrae, and nerve roots. Let's now look at how back injuries occur. The type of back injuries. First is strain. Strain is an injury due to overusing or overstretching your back. Next is sprain. Sprain is a ligament in the back that is torn or excessively stretched. Next, bulging disc. Disc begins to come out from between the two vertebrae. And last is herniated disc. Disc begins to leak its cushioning fluid. Again, here's a picture of what we just discussed, first showing a degenerative disc, then a normal disc, and how fat and cushy that looks. Then a herniated disc with a bulging out toward the nerve or vertebrae endings. Then you have, again, the degenerated disc with arthritis, which causes bone spurs and nerve ending damage. These are common problems that occur in the back. General causes of back injury. Usually a combination of causes. One is poor posture. Next is an unconditioned back. Next is excessive weight and pot bellies. Next is bad lifting techniques. And next is an underlying medical condition. All right, from the list below, select the activities that could cause a back injury. Let's go over them together. Reaching, bad posture, tying your shoe, bending, twisting, sitting, using poor lifting techniques. All of these can cause back injury. Activities that can cause back injury. First of all, reaching or overstretching the back. Next, bending over, even as easily as tying your shoe. Next, poor posture while sitting. And last, poor lifting techniques. Back injury conditions and causes. Do you understand why back injuries happen and the types of injuries? Ask yourself if you understand the information presented so far. If not, we can go back and go over, or you can rewind this webinar to find out more answers to your questions. Injury prevention. Maintain proper posture. Maintain the back's natural curvature, if at all possible. Stand straight. Sit properly. Improve your posture. And last, stretch regularly when you have an opportunity. Injury prevention, condition your back. Physical condition of your back means not only improving your back muscles, but also related muscles such as the ones in your stomach and thighs. Regular exercise should help keep your back strong, maintain your flexibility, and prevent strains and sprains. Staying flexible and limber is also important. Your exercise program should emphasize flexibility so that you can bend, turn, and twist your back without injury. Try to lose excessive weight that contributes to poor posture and puts a strain on your back muscle. Your exercise program should also help you lose weight, another way that exercise helps keep your back healthy. And finally, consult your physician before starting an exercise program or any weight loss program. Injury prevention exercises. Here are some of the exercises you can do to prevent back injury. These exercises are intended to improve your conditioning and flexibility while helping you lose or maintain your weight. But remember to consult with your doctor before starting an exercise program. Walking of 30 minutes a day will help strengthen your muscles and prevent weight gain. A daily program of stretching exercises will help improve your flexibility and keep your back in good condition. Stretching exercises might include bending backwards or sideways, rotating your hips, or twisting gently from side to side. Sit-ups help strengthen your stomach muscles, which in turn help support your back. Leg lifts help strengthen the muscles in your hips and buttocks. These can be done when you're standing or while lying on the floor. Another good exercise is squats. These strengthen your back, stomach, and leg muscles and also help you practice good lifting techniques. Now, an exercise for injury prevention, fill in the blanks. Try to maintain your body's blank blank when you are sitting. Natural curves. Next, sometimes a blank helps maintain a proper position when you're sitting. A footrest. Next, when standing, stand straight with your blank back, your blank up, and your blank shoulder width apart. Your shoulders back, your head up, and your feet shoulder width apart. Exercise injury prevention continued. Fill in the blanks. A program of blank for 30 minutes a day will help strengthen muscles and prevent weight gain. Walking. Next, blank blank of your back means not only improving your back muscles, but also related muscles such as the ones in your stomach and thighs. Physical conditioning. Next, staying blank and blank is also important so you can bend and turn without injury. Flexible and limber. Safe practices use lifting equipment. One good way to prevent these injuries is to use lifting equipment rather than trying to lift and carry heavy objects manually. Some of the equipment you can use include power equipment such as forklifts, powered carts, and electric pallet jacks, hand trucks, carts, and pallet jacks, cranes and hoists, conveyors. Have a safe lifting plan. Before lifting or carrying a load, have a safe lifting plan. This doesn't mean a written plan. It simply means thinking about what you're going to do before you pick up and carry a load. First, size up the load, the weight, the shape, and the size. Next, clear the path. Clear the path of objects, tight doorways or corners, and make sure all hazards are removed. Unloading zone. Think about unloading the object. Make sure you have a clear, accessible area so that you can unload safely. Now we're going to go over the proper lifting techniques. Let's discuss the techniques for lifting properly to prevent back injuries. When lifting an object, remember to always Stand close to the load with a wide stance. Next is bend at the knees. Next, pull the load close and grip it. This helps you in your balancing. Tighten your stomach and lift your head, which will put you back into proper posture. Rise using your legs. Remember, your legs are made for lifting, not your back. Now let's go over the technique for proper bag lifting. First, squat next to the bag. Next, grab it at opposite corners. Lift it up to your thigh or waist. Stand up. Put the load on your shoulder. Now let's discuss team lifting. Some loads are too big or heavy for one person. These require team lifting, which also requires proper techniques in order to be safe. So first, let's designate a person to lead the lift. Next, lift at the same time. Example would be on 3. 1, 2, 3, ready, lift. Keep the load level. Slowly unload together. Now let's talk about proper carrying of the load. To prevent back injuries, it's as important to carry the load properly as it is to lift it. So first of all, make sure you can see. Trying to save time by stacking objects is not worth getting injured because you can't see clearly. Take small steps and make sure your footing is stable. Be especially careful on steps, ramps, and areas with uneven surfaces. Don't twist your back when carrying a load. To turn, move your feet rather than twisting your back. All right, let's talk about unloading properly. Unloading properly is also important for preventing back injury. Basically, unloading is a mirror image of lifting a load. Remember these rules for proper and safe unloading. Squat with a load bending your knees. Don't bend your back. Instead, keep your back straight and let your legs do the work. And as a final tip, keep your fingers away from the bottom and sides of the load so they don't get pinched or crushed. Now we'll talk about handling overhead loads. When handling loads that are over your head, it's very important to observe safety procedures in order to avoid an injury. Remember, stand facing the load. Don't reach up to pick up a load. Instead, use a step stool or ladder to get your shoulders level with the load. But don't stand on a chair or a stack of boxes. This could cause a fall. Slide the load close to your body and grip it firmly. Finally, maintain good posture and use your legs to step carefully down the ladder or step stool. If necessary, have someone else spot you to make sure you don't lose your balance. Let's talk about handling long loads. Long loads such as lengths of pipe or lumber can be very tricky to handle even if they are not that heavy. Here are some techniques for handling long loads safely. First, pick up one end of the load to make sure you can handle it by yourself. Walk toward the center of the load until you have found the center or balance point. Place the balance point on your shoulder and stabilize the load with your hands. Watch the ends of the load to make sure you don't strike people or objects. You may want to raise the forward end and lower the lower end behind you so that you will avoid striking someone in the head. Shoveling snow. If possible, wait until the afternoon to shovel. Lift smaller loads, not heavy shovelfuls. Use a shovel with a shaft that lets you keep your back straight while lifting. Avoid excessive twisting and forward bending. Step in the direction in which you are throwing the snow. Take frequent breaks. Think about your back. The next few slides bring together what Been discussing about proper lifting and carrying techniques to save your back. The most important to think about your back with every movement you make. Be diligent. Sometimes it seems easier to simply bend over to pick up something rather than squatting and lifting it properly. Be sure to use proper lifting techniques. Think long-term about your back. Lifting something improperly may not hurt you at the time, but long periods of improper lifting and carrying will increase the chances of your back injury eventually. Don't try to lift too much. Get help if the load's too heavy for you. Remember that you're not competing with anyone or trying to win an award. You're trying to save yourself from injury. Always consider your back in all daily activities. Think about your posture, or whether you're in the right condition for a physical activity, or whether you're using proper lifting techniques in carrying an object or even a child. What's wrong here? The slide shows an example of how a back injury can occur. It shows a man trying to move heavy boxes of polymer film onto a pallet by himself. Each box weighs 100 pounds and is long and thin, 6 foot long by 1 foot wide. The man is wearing a back belt and has been trained in proper lifting techniques. He tilts the box towards his body. The man stands the heavy box on its end, then rotates it on its bottom edges so that he doesn't have to lift it onto the pallet. Suddenly, the box starts to fall over as he's moving it. He tries to catch the box as it's falling and strains his back. What went wrong in the scene you just saw? Could the employee have prevented his injury? First of all, the box was probably too heavy. Although he tried to avoid lifting it by standing it on its end, 100 pounds is too heavy a load for most people to handle. Second, the box was probably too big to move alone. A 6-foot box may be too big and awkward to grip and handle without help. Did the employee follow proper lifting techniques? The accident happened when the employee tried to prevent the box from falling over. He did not maintain good posture when he had to bend and twist suddenly. When he tried to stop the heavy box from falling, his awkward posture contributed to the injury, and clearly he did not have a good grip on the box. What about the back belt he's wearing? Many workers think they can do more than they really can if they're wearing a back belt. Injury prevention. Now it's time to ask yourself, do you understand the information so far? Key points to remember. Here are some key points to remember about back safety. Always maintain good posture when standing, sitting, lifting, carrying, and simply moving about. Try to get exercise regularly to keep your back in good condition. Use lifting equipment rather than trying to lift something manually. Have a plan in mind before you lift and transport any object. When lifting or unloading an object, use your legs rather than your back. Bend at the knees when you lift or unload. Finally, always be thinking about your back and what you should be doing to lift and carry safely without risking a serious injury. This concludes the webinar from VACORP on back injury prevention.